breast cancer can be missed in the standard of care screening, which is mammogram. As an engineer and knowing ultrasound is safe, it can be used for pregnant women and babies. I always wondered why it's not used for whole breast imaging and breast cancer screening. What are the challenges? We are technically marrying these two worlds together to have the world's first portable automated breast ultrasound system that does not require any skill to operate other than being a healthcare professional, and it can be taken to any setting. So we really want to bring this imaging outside of a radiology center, to bring it to point of care, to where women are. It could be in a community setting, it could be in a rural setting, it could be in a mobile van. I'm really happy that we have this opportunity to invest in this part and for the grants that help us to achieve our goals. Shadi Saberi. I'm co-founder and CTO of iSono Health. I'm an electrical engineer by training. I got my PhD from Carnegie Mellon in Pittsburgh. And I started iSono Health because of a personal experience of losing a loved one to breast cancer. And our mission is to make sure no woman ever dies from breast cancer through early detection. So after losing a loved one, I realized that breast cancer can be missed in the standard of care screening, which is mammogram. And my mom is actually a radiologist who practiced outside US. Through her, I understood half of women have dense breasts, and mammogram is not sufficient for them. They need supplemental imaging, and ultrasound could be a good alternative. As an engineer and knowing ultrasound is safe, it can be used for pregnant women and babies. I always wondered why it's not used for whole breast imaging and breast cancer screening. What are the challenges? And digging into it, I realized one of the biggest problems is that whole breast ultrasound requires a very specialized skill of a breast sonographer or a physician, and it's also very time consuming. It can create, ultrasound is very sensitive as a modality. It sees a lot of things, but it's not as specific, so it can create more false positives. And in a lot of places also there's shortage of people who can do this breast ultrasound, so it is only used after an abnormality is detected in mammogram. But if you have dense breast and mammogram cannot see through the tissue very well, the cancer can get missed and a woman can get diagnosed with late stage breast cancer while their mammogram could have been clear a couple months earlier. So this really motivated me to find out how we can solve for these issues that exist with creative engineering solutions. One of them, how can we automate things so that we don't really need a skilled sonographer? Anyone, any healthcare professional can operate that machine. How can we make it portable and low cost so that it can be deployed in many settings, not just in a radiology center, but at point of care in low resource settings, in community health centers, in rural settings, in a mobile unit. And that has a lot of even global health implications where mammogram is not even available or accessible. So that's kind of our vision and mission, to make sure no woman ever dies from breast cancer, because breast cancer is one of the most treatable cancers if detected early. Chance of survival is 99%, but unfortunately today still the mortality rate has not decreased. Since the past 20 years, it's actually increasing, and in a lot of countries that lifestyle changes are happening, and they're developing countries, they're becoming more industrialized. There's actually a huge rise in breast cancer. And there's also another alarming thing is breast cancer in much younger women. That breast density is also very related to age. So the younger the women are, the more dense the breast tissue is. So that means mammogram becomes very ineffective for these women. So this is really our goal, to make sure that early detection is accessible to women, regardless of where they live. So that that is the mission of the company, and we're still at the early stages. So our device is basically a mini robot. So this is actually our device, and it uses a transducer that is similar to what is used in a handheld probe. It gets attached to a variable accessor and gets positioned on the breast, and it can automatically scan the whole breast completely hands-free in 2 minutes. So that means that any healthcare professional can be trained in a couple of hours to place this on a patient, and the software guide them through all the steps that they have to do, and then press a button and it will scan. After the scan only takes 2 minutes. We do 3D reconstruction, and these images are available to be reviewed by a trained physician or a radiologist. This part of the system, the imaging parts, the 3D reconstruction, and the software is already FDA cleared. We're working in adding advanced AI, because one of the things that is happening during a manual handheld ultrasound with a sonographer or a physician is not just a mechanical part of the scanning. That part we have automated. There's also a lot of cognition happening, that the human is looking at the tissue, finding abnormalities, trying to look at those abnormalities from different angles to make their decision if this is something that is suspicious looking and requires further evaluation. So that part right now is still has to happen offline. One thing that we have done is we completely decoupled the acquisition from interpretation, because before that, the person who was doing manual scanning have to do the interpretation real time where the patient is there. But right now we get the whole volumetric data, reconstruct, and can send it off-site to a remote radiologist across the country or even across the world to be able to interpret that. But this can even be improved if we can add AI that can do the inference real time, to be able to triage the patient, to be able to detect the abnormality and let the operator know that they can further follow up with same actions there and on site. A lot of places, the patient have to travel to go to another imaging site. So we can reduce that need for travel by adding this AI. We can also improve the workflow of the radiologist, and make the diagnosis more accurate. Our competitors that are existing right now in the market are either portable handheld ultrasound systems that, for example, Butterfly or all these big companies do have a portable system that may connect to your iPhone, and they are called point of care ultrasound or POCUS. These systems still require a skilled physician or a sonographer to be able to operate them. There's some AI that is getting developed to let an untrained user to be able to operate, but usually it's for applications that are easier to identify an anatomy. One thing about breast tissue is that everyone's breast tissue is very different. Breast tissue is like a fingerprint, and it's very heterogeneous. So things can look like that could be normal, can look like something that is abnormal or malignant. So it requires a very specialized training. Even not every sonographer can do breast ultrasound. So that's why it's very hard for these systems to scale to the breast applications. A lot of them don't even have the necessary resolution or image quality to have a breast application. On the other hand of the spectrum, there are console-based ultrasound systems that are the traditional systems. They still are used in many imaging centers with the specialized sonographers. And then we have the large equipments that are automated breast ultrasound. So big companies like GE have one, Siemens have one. There are some larger startups that also have one. Some of them are bed size that the women have to lie down and their breast hangs in a water tank. So there's a lot of innovation in that space, but mostly they are positioning their device again for a large imaging center and radiology centers. Their capital equipment, they require a whole room, and the price point is hundreds of thousands of dollars, so it's not really an accessible solution. We are technically marrying these two worlds together to have the world's first portable automated breast ultrasound system that does not require any skill to operate other than being a healthcare professional, and it can be taken to any setting. So we really want to bring this imaging outside of a radiology center to bring it to point of care to where women are. It could be in a community setting, it could be in a rural setting, it could be in a mobile van. So that is how we think we can increase access. So I think the biggest issue is really that operator dependency, which is a big issue in breast ultrasound. The skill of that sonographer that does the breast ultrasound completely defines the course of diagnostic. If they are not able to get good images, if they miss an area, then the radiologist that further is looking at the images cannot diagnose correctly, and that's why. And the quality is hit and miss. So we hear a lot of times radiologist says, I don't trust what my technician did. I have to go in the room and back scan myself. Um, and it's also very time consuming. So we're trying to completely take that out of the operator dependency out of the equation, make it very repeatable, consistent quality, and also do a whole breast, so that we make sure that we covered everything. So the radiologist will be confident that what they're reading is the whole breast, and also workflow. The scan that we do with our device only takes 2 minutes, while a manual breast ultrasound can take 20 to 40 minutes. So it's both speed, workflow, and repeatability and quality. Currently, we sell to providers. And we have different customer segments that we sell to. There are imaging centers that are interested in having this device in their satellite units or their mobile mammograms. Then there are, breast surgeons. Breast surgeons see a lot of patients with breast complaints, so they would like to do this in their office. Or when a patient is diagnosed, they want to image them with 3D reconstruction and do pre-operation planning. And then we also have like the primary care, so the primary care OBGYNs that are already seeing patients for their annual checkups. They would like to do this as part of their annual checkup if the woman goes to get their mammogram and they know they have dense breast. Instead of the woman waiting for weeks to get scheduled for a whole breast ultrasound, they can operate this in their own office and then have a remote radiologist read them. Key milestone for us, the first one that we were able to achieve our first FDA clearance. And right now we are in early commercialization, but major key milestones that we are working towards is starting a multi-site large prospective clinical study to build a multimodality breast imaging registry to be able to and validate the different AI modules that we are working on. and after that submit for our additional FDA clearances, as well as being able to deploy to sites from different type of healthcare settings that I mentioned, and see how this product operates in the real world. We use AI in the whole stack of our from data acquisition all the way to the interpretation and diagnosis. We use deep learning AI, but we also have traditional models as well. So it's a combination, but most of them right now work with computer vision. We are working on more advanced models that work with our raw data. One of the advantage of our system compared to traditional ultrasound is we actually take the raw signals out of ultrasound before they get converted to grayscale images. So there's a lot of rich data about the tissue in this raw data that gets filtered before it gets converted to images. And we are working, there's a field, it's called quantitative ultrasound, that have shown that you can see tissue physiological properties of the tissue from this raw data. So that's another field of machine learning that we're working on. But in general, we have in the acquisition image processing, we have different type of models for image enhancement, for denoising, and then after the reconstruction, we have a lot of models for automatic lesion detection, classification, segmentation, breast density calculation, risk estimation, that are more on the patient care side and clinical decision support. So AI right now in our product is was getting developed from day one. We have this vision that AI is a critical component of our system, and everything was designed to have AI seamlessly integrate. So for the user, for the end user, this should not be something that um, they see like there's an add-on. It's already integrated and it makes their workflow easier and seamless. This is really what we want to achieve with AI, um, both in terms of image acquisition. When the operator, who we think is not someone who is familiar with ultrasound, they don't know how to set up image settings. So AI can help with setting up image settings. AI can help with knowing there's image quality issues, so informing them what to do and how to correct and repeat imaging. In the diagnosis part, one of the things that we hear from radiologists is that these 3D images, these 3D automated breast ultrasound systems are take longer to read because we have so many slices. It's comparable to what the time they spend reading an MRI or a CT. So they want this time to be faster. So our hope is AI will help them do their read faster and make their workflow annotations, and a lot of manual things that they have to do. They have to compare things with the prior images, all of them automated, so that they their work will be more efficient and they will be more confident in their final decision. So one thing that we have so far tried to achieve was we're developing models, and they're still in the R&D stage. But what is important for us, as I said, is the user experience and user interaction of the different users that we have. It's the physician, and the physician can be different type of physician. It could be a radiologist, it could be a surgeon, it could be a primary care, and then there's the operator as well. So uh, the experience that each of these um, personas do have with the AI is different. We usually prototype our AI into the product and try to show a demo to them to get feedback. But that feedback session usually happens in a very sporadic, like when we go to trade shows or we do have a demo, and the design needs to get refined so that we can make sure this part of the product, which is the AI, which is the interaction of the human with the AI, gets designed properly, that we're addressing their unmet need. We don't want to think, because we hear a lot of times from radiologists that like, oh, I don't trust that AI. Like every time it says something, I think it's wrong, or we don't want that experience to happen with our models. We want to make sure that we completely take into account and see them as a partner that give us feedback of what they need, because as engineers and external people, we might have an idea of what might make their life easier, but that might not be true. As we see, like when you talk to a lot of radiologists, they say that everyone focuses on like all these sexier things, that like, oh, diagnose things, but that is not really, I'm already good at that. What helps me is like make the job of me writing or measuring or doing things that are so time consuming faster for me. And that's how we see like LLM is getting a lot of traction in radiology, because the whole reporting part is the part that is taking a lot of time from them. So this is the thing that we feel we lacked, and we're hoping that with this grant we have a better understanding of the real user need and the experience and interaction they want to have with AI. That we do have a good idea of how this design gets prototype, and how we're going to implement it, because this is our next step to have like the refined design implemented with the models that are getting trained and ready to be validated. Because the validation of our models, because models are already integrated in our product, is not just the model performance. It's the whole design and the interaction of the users, and see whether we are improving user performance compared to what they didn't have access to the AI. So this is the validation we want to get out for our FDA submission. That we achieved a design, and that makes the end user happy, and they're excited to try and work with it. And also our engineering team feel that that's something achievable to be implemented. I feel like in general, people underestimate that human computer or human AI interaction in this point, and the value that thoughtfulness will bring. So I'm really happy that we have this opportunity to invest in this part, and for the grants that help us to achieve our goals.